Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Suresh Babu. He did his MD in General Medicine and DM in Medical Oncology, and now he is Professor Head of the Department of Oncology in Kidwai Memorial Institute of Cancer. And what is more, he is a very popular doctor, and patients who have got treatment from him and they have recovered and they are very grateful to him. So today he is with us to explain how the lung cancer comes, why it comes, and how it can be treated. Sir, nowadays, many people are dying at a young age due to the lung cancer, and people are not bothered. Only the family starts crying and they forget about it. And we have to educate the whole society as to prevent it. And in that direction, please tell us what are the causes for this lung cancer?
Madam, if you see in the world, the number one leading cancer in the world today is lung cancer. You can take the data of Globocon, whatever in India, whatever it is. So lung cancer remains the leading cancer of death, and it is the most common cancer diagnosed across the world in our country. The main reasons being is the usage of the tobacco products, majorly the smoking, whether it's a cigarette or BD smoking. Another important being is that the smokers not only harm themselves, they harm the society and family also.
Yes.
So passive
And the
smoking
family
is
members, the wife and the children
also.
also.
So passive smoking is also been one of the reason why the lung cancer has been rising. The second more important factor is the pollution. So because of the motor vehicles and all, we have been exposed to so much of pollution that is leading to more of the respiratory diseases, including the cancer. The third reason being the
Yes.
occupation hazard. Some of the people who are working in certain industries like production of glass and all, where they are exposed to more of the silica and all those things. So those are the people are also at the high risk of cancer. So these are the most common reasons for the cancer. But in spite of that, without being any etiology of this, cancer may also come, but we need to be vigilant in such cases.
Okay. Can it also come due to the genetics, sir?
Genetics can also be a cause of lung cancer, but that constitute for a very
And what about the lungs? I mean, the infection and the genetics?
no, infection will not lead to a lung cancer per se, madam, but genetics
Okay, per
can.
se.
Some genetic
Genetic can.
syndromes are
Okay, okay,
associated with lung cancer, but their
okay.
constitution is very
Is
less.
very less, very
Yes.
less. So it is more of the lifestyle and the bad habits that are causing the
Yes.
thing. So
Absolutely.
now, once upon a time, only X-ray was available. But today, the new techniques have come to detect at the early stage. So what are the new techniques to detect the lung cancer?
Madam, now there are certain recommendations where we can detect the lung cancer in early stage. Number one being that we are following a low dose CT scan, especially in a patient who are high risk. High risk individuals, I mean patients who are chronic smokers, smoking for more than 20 years and smoking 10 cigarettes or BDs per day, or as high risk of developing cancer, they are expected to go for a CT scan, not a routine CT scan, the low dose CT scan, because radiation exposure is also not advisable.
Okay.
So they have to undergo low dose CT scan whenever they go for a screening. That is one method of detecting very early. So as I was telling, the other thing is there are other modalities which are available in the world. Number one is the PET CT scan. PET CT scan is basically not done for screening methods, but when a cancer is diagnosed, to stage that, to know where all it is spread, the PET CT scan is the nowadays the modality of imaging, where it will give a correct idea to us where all cancer has spread, and it is also modality to monitor the treatment.
Okay. Okay. So this is how you can detect.
Yes,
Is
ma'am.
still the lung biopsy is important, and is it done or not done, and when it is done?
Madam, lung biopsy is very, very important. Without lung biopsy, we cannot treat a lung cancer because lung cancer itself has so many varieties in that. Until
Yes.
unless we do biopsy, we will not know what subtype of lung cancer it is. So, lung cancer biopsy is very important. One of the things, disadvantages of the biopsy in lung is that you will not be able to get material like how you get in a breast cancer or head and neck cancer, because lung is
Yes.
not
Yes.
such a easily accessible organ.
Yes.
So, however, it is with minimal things also, you must do a biopsy and try to get the result out of it. Another thing to that, add to that is that lung cancer is now has become a disease of molecular oncology, that we do certain markers, more than 10 to 12 markers in the lung, and based on that we decide the treatments. To do that markers, we may not have sufficient material when you do biopsy. If sufficient material is there, we can do on that. If that is not there, we can do that molecular markers in the blood also. That we call it as circulating tumor cells. So we take the blood, we isolate the blood, on that we do certain molecular markers. So nowadays what we do, we also take the blood, we also take the biopsy, we try to do wherever we get the markers, we are going to treat accordingly. That is the era in which lung cancer treatment is going today.
Okay, okay. Now, what are the ways of treatment, sir? Only if it is early stage, you do the surgery and excision. But if it is advanced, what are the things? So please explain what are the facilities or the modalities of treatment available to the patient today.
Yes, sir. Madam, the major treatments available today, if it is early stage, you are rightly told, we will do a surgery. Sometimes we may have to give adjuvant treatment to that, maybe some chemotherapy or targeted therapy. In a locally advanced disease, we will give chemotherapy along with radiation. In that cases, we may not be able to do surgery. In a very advanced cases, the role of radiotherapy and surgery is limited. We will give only systemic therapy. Systemic therapy, I mean, it includes chemotherapy, it includes immunotherapy, it includes targeted therapy. So targeted therapy and immunotherapy is something new happened to the world today. See, as I was telling
Yes.
you, when with the tissue, we will try to do some molecular markers. If any one marker is positive, which have a targetable, we can, some markers we can just treat with tablets itself. We don't have to give, chemotherapy and all. There are some conditions where we may have to give immunotherapy. So what the immunotherapy and targeted therapies have done is, the 10, 12 years ago, the survival of a stage 4 lung cancer was less than 2 years. Now we are looking at survival of 5 years or more, even in the advanced stage. So that
Okay.
is because of the advancement happening in the targeted therapy and the immunotherapy. Many people in a stage 4 lung cancer have survived 5 years or more. So that is something new that happened to the lung cancer.
Yes, I remember, when film actor Sanjay Dutt was diagnosed as stage 4, everybody thought he's gone, but then he came back after the immunotherapy and then he recovered. Now he has acted in Durandar. And, the new lease of life is given to the patients.
Madam,
So
that
that is a wonderful thing today, what is happening. Yes, sir.
yes, ma'am. That is the, I think he was treated with the immunotherapy. And one of the things with immunotherapy is that some people respond so well to immunotherapy that they remain in remission for years. Now he has treatment, and it ultimately stimulated his own system to fight against the cancer. So
Fight
he is
against the cancer cells.
uh,
Yes.
he is under remission for years now, more than 4.5 years.
Yeah.
So as you rightly told, this is something like you could have never thought of it 10 years
Yes.
ago. Now
Yes.
you can see that a stage 4 lung cancer person surviving 4 5 years without any treatment is something miracle happening because of the
Yes.
new modalities of treatment.
Yes, yes. It is like modernizing our armed forces, In the
Yes, ma'am.
same way, the targeted treatment, the
Yes,
surgical strikes are occurring even for the cancer cells and
absolutely.
the tumors.
Absolutely,
And
ma'am.
that is a
Absolutely.
wonderful thing that is happening. But
Yes, ma'am.
still, prevention is better than cure. What do you say, sir?
Absolutely, madam, because Sanjay Dutt is one of the luckiest patient where drug worked. See,
Yeah.
we don't know drug will work for everybody. We do have a very advanced treatment, but as you rightly told, prevention is the better way, because if you don't prevent and if you have, ultimately it's the medicine and your body which decides, it's not in your hand. So if your body cooperates, then only you can get into the remission. Prevention is absolutely better, as you rightly told. Like we discussed before, tobacco usage and usage of alcohol, going to pollution, and people who are working in the industry to take this measure to avoid the dust
Yeah,
exposure
better
or
to
the
wear the
chemicals.
mask when they are going
Yes,
in the
yes,
polluted area
yes,
and the dusty area.
yes,
Yes,
yes. So
sir. Yeah.
those measures are very, very important. But it's as ultimately, as you said, prevention is always the number one
Yes.
defense. So if you have prevented it, you don't have to go through that. I think that's the right way of putting
Yes,
it.
sir. I fully agree with you, sir, because, when we talk about prevention, especially the only preventable cause of certain death, either by heart attack or stroke or by cancer, is the tobacco. So say no
Yes.
to tobacco right from the childhood. And
Yes.
unfortunately, the younger generation are aping at the not only the best, the film heroes, and that started smoking. And that is very bad. I think all the parents, they should set an example to their children not to smoke in front of them and not to show the pictures or the heroes who are smoking. And that is very important. And we have to tell and scare them that, look, this is what happened. And that's what we tried, sir. We got the cancer picture printed on the cigarette. Otherwise, it used to be just injuries to health in a very small letter. And after that, 50% it had come down. But today, you name the picture, the heroes and the villains all are smoking all the time. And I think the something has to be done to prevent this, the heroes and the film actors propagating this smoking, sir. And more than
I
anything,
agree
yes,
with you,
sir.
madam.
Please, sir.
I agree with you, madam. I think if you go to movie, it's even in the interval, beginning of the movie, they show, some patients who have been smoked and other things that people, I don't know how they are moved by
They
movies.
forget that. They
Yeah,
forget
they
that
will
and then
forget that
listen to,
introduction
yes.
part. So it's very unfortunate that. Now, another thing I wanted to tell you that biologically, the smoking related cancers are difficult to treat than non-smoking cancers. Some cancers
Ah.
coming, just out of genetics or some other factors usually respond well to the treatment, especially in lung cancer. What we are doing, targets and all are more likely to be positive in cancers which doesn't have history of tobacco. So biologically, the tobacco-related cancers
Very
are very much
difficult to treat.
complicated to treat. So very difficult to treat. And one more thing is that the smoker's lung would have been already compromised
Already
from
damaged, yeah.
smoking. Yeah. So even if you plan for surgery or any treatment, it's difficult for you to cope up with such lung cancer which has already damaged. They may have underlying cardiac problem also. So I
Yes,
think
sir.
smoking wholly will destroy a person as a whole. So I think, as you rightly put it, keeping away from the smoking
Yes,
and
single
other things.
important preventable
Absolutely.
cause of death is
Yes,
tobacco.
is
Yes,
smoking.
sir.
Absolutely.
Yes, sir. Yes, sir. And not only that, sir, during the corona also we have seen, the smokers died much more than the 90,
Absolutely.
100 years old people who
Absolutely.
had no bad habits at all. So
Absolutely.
I think the younger generation should learn from your talk and then your advice and then see that they keep away from these bad habits, especially smoking and drinking.
Yes, ma'am.
So thank you very much that you have given a what to say warning bell to them. At the same time, you have also given a new hope that they can be treated and they can be saved because the treatment and the diagnosis advancement are there. So thank you very much, Dr. Suresh Babu, for explaining so well. We are very grateful to you. Namaskar.
Thank you, madam. Thank you. Namaskar, madam.